approximately 2 million Americans suffer from dizziness each year. And what's more, it is estimated that falls are the leading cause of death from injuries in those over age 65. But falls and head injuries affect far more than just the elderly. People in every age range suffer head injuries as a result of accidents, slips, and falls in the home, school, and the workplace. So the question is, how can you determine if you suffer from a balance disorder? And if you do, how can you get help? In other words, how can you bring balance back into your life?
One day I was driving down the road and it happened, so I had to stop because I could not see or tell where I was going driving the car.
I fell a couple of times, particularly at night, getting out of the bed, and you might experience the same thing. You throw your legs over the bed and you get up to walk and you do it too quickly at night, and your vision is not there, your sense of balance is not there. And I fell twice at night.
Everything starts going over and over, and it goes really fast. And when I get up, I have some dizziness.
I started falling, I fell about 3 or 4 times in about a week. So I went to the doctor, and he checked me all out and said I had Parkinson's.
Balance disorders come both from the central nervous system and from the inner ear, as well as from bones and muscles and joints. People may experience a varying array of complaints that range from spinning dizziness to unsteadiness, to falling over sensations, as well as a generalized feeling of being unbalanced. Patients may, for example, become unable to actually perform daily grooming habits, may be unable to take a shower or clean themselves or feed themselves or those kinds of things. Also, patients may lose the ability to drive or to actually become socially interactive. And since their major fear is that of falling, they may become recluses and simply withdraw from society.
For many, vestibular rehabilitation therapy, or VRT, has become an answer to the challenges facing someone with a balance or dizziness disorder. Dr. Marion Girardi is a renowned expert on vestibular rehabilitation therapy, having authored many scientific papers about this groundbreaking, patient-friendly technology.
Vestibular rehabilitation therapy is a customized exercise program designed to have a patient compensate for losses in the vestibular or balance system. It's been known that exercises can help improve balance for over 70 years. The first protocols were published back in the 1940s. What's changed recently is that instead of giving somebody a shotgun approach exercise treatment program where they do every single exercise all the time, what we've done is customize the exercises to fit the specific problem. Unfortunately, it's not as well disseminated as we would like to see it. Many primary care physicians are still telling patients that either they need to go on these vestibulo-suppressing medications, which in some cases are more than inappropriate, they're harmful, and also to just go home and learn to live with it. You know, if the patient tells the physician, well, I get dizzy when I move too fast, physician says, well, then don't move so fast. Well, that's fine, but it's still not coping with the problem.
The way it's done is by repetition. For example, if a patient complains that getting into one particular position tends to make them dizzy, by getting into it and out of it, into it and out of it over and over and over again, the balance system can be retrained such that the diseased aspect of the balance system can be overcome and the healthier portions can actually be augmented and made to function better and take the place of the disease system.
Compensation is a process that occurs normally in the brain. The brain has got multiple pathways for every function that we do. It's very redundant, which is wonderful. But when we have some of these deficits, we need to signal the brain that we need to utilize alternate pathways, and that's what occurs with the therapy and with the compensation process. Vestibular rehabilitation therapy also is graduated. We start a patient at the level that they can best perform and then gradually build up into more and more difficult types of exercises as the system starts to compensate, so we can increase the level of compensation and keep it going.
It has been shown through multiple studies that the number one reason for nursing home admissions in the United States today is fallers. And actually, it has been shown also that perhaps 30 to 40% of those falls could be prevented.
Simple and effective. A diagnostic and therapeutic technology that's non-invasive, time-tested, and proven to work. Amazing, isn't it? Now that you're aware of VRT, how do you set about an action plan to get you feeling better and help renew your independence? Under the direction of a physician, tests will be performed on the 4 areas that affect your sense of balance: vision, nervous system, muscles and joints or musculoskeletal, and inner ear or vestibular.
In order to look at therapy, you just can't apply a broad spectrum therapy to every patient. In conjunction with our video diagnostic equipment, we're able to determine the etiology or the cause of the balance and dizziness problem. And then we have designed programs and protocols specifically for each of those disorders.
When designing a customized vestibular rehabilitation program for a patient, it's paramount to have information from some tests that are run prior to the exercises. These tests usually are video ENG and a type of posturography. With the ENG testing, we're looking at central brain and inner ear functions and how they affect balance. Things like eye movements, changes in head and body position, and also stimulation of the inner ear. With the posturography equipment, we're looking at overall balance, information that's coming from the 3 major inputs into balance: the inner ear, the eyes for vision, and the muscles and joints for somatosensation or proprioception. So in order to maintain a good overall balance, you have to have information from all 3 of these systems. And if one system is either depressed or lacking, then that's the area that you target the vestibular therapy for to improve the patient's balance and reduce their dizziness symptoms. Frequently, we can be done with all these tests on a patient in less than a 2-hour time span, and we're ready to start their vestibular therapy program immediately after we have the results.
Fortunately for us, and fortunately for the patient, these therapies are all being done at Johns Hopkins, they're being done at Stanford, UCLA, USC, Mount Sinai, all of the major medical centers and hospitals across the United States. And when you mention the names of these other facilities and you talk about the research and the success ratio that we have with these patients, we can really get the attention of the physician. The primary care physician is really kind of the gatekeeper, and they see more patients that have dizziness and balance disorders than any other physician in the country. And they need to be made aware that there are avenues that are available to them that can literally diagnose and, more importantly, in my opinion, treat these patients so we can get them off of meclizine and antivert and help prevent or reduce the risk of the fall.
With the vast majority of our patients, we see them resuming the type of activities that they were able to perform before the onset of their symptoms. Obviously, if there are other physical conditions that may affect them, they may not get a complete resolution, but their dizziness and balance symptoms at least are disappearing. Generally speaking, about 3/4 of the patients who come into the clinic and receive this customized program report significant improvement within that 6 to 8 weeks of time frame.
At first I didn't think there was, see what it could really accomplish by getting on that disc and being real unstable, but then it has helped. When I went through the therapy, I could see some improvement.
At the end of about the 3rd session, I could feel a noticeable difference. My limp began to go away, and then my skepticism began to go away, and I look forward to the remainder of the therapy, thinking, hey, this is really going to help.
As a clinician in this field, the therapy is very rewarding. Patients are extremely grateful when they find that in a matter of a few short weeks their symptoms have resolved. It's not uncommon for patients to come in and say, I simply can't believe it. When you told me that these little exercises were going to make me better when I've been dizzy for 20 years, I'm just overwhelmed.
When patients are going through their therapy, I hear a lot of different comments like, well, number one is thanks. They do say thank you a lot, and they mention that they feel better and that they can walk without holding on to the wall, or just that they can do a lot more activities and they feel better is the main thing that they say.
Vestibular rehabilitation therapy, a truly incredible technology that is amazingly effective, simple, and safe. And now the government and insurance industry have finally taken notice and made fall prevention a priority. Vestibular rehabilitation therapy is now covered by most insurances.
There's nothing more rewarding than to have one of your patients tell you that you've helped them significantly regain focus of balance in their life.
100% improved, I would say. I went from skepticism to being amazed through this whole thing, and my balance is back. I feel good about that. I don't have concerns about it right now.
Back in 1999, after a series of 14 operations, I lost my right leg below the knee, as well as about a third of my left foot to complications of osteomyelitis. And fortunately, I've been able to regain my health, but at one point in my life, I required several hundred hours of rehabilitative therapy, a lot of which was vestibular rehabilitation. This has made a huge difference in my life and has enabled me to return to the practice of medicine and patient care.
I feel like it's going to be a lot better for me to do my everyday things and go shopping, which I enjoy.
I feel a lot better because I know that I'm getting better. I mean, improving my balance where I could do things or walk better.
When I get done with all this, I want to go and jump on my bed and lay down. It's been so long since I could lay down and not be dizzy. And that's my biggest strength.
I hope this has helped answer your questions on the road to bringing balance back into your life.
I could not see or tell where I was going driving the car.
What if you began losing your balance and experiencing dizziness?
Vestibular rehabilitation therapy is safe, non-invasive, and time-tested. It restores your balance through customized programs for your individual needs and lifestyle.
My balance is back. I feel good about that.
Call the Balance Disorder Center now for your consultation and bring balance back into your life.